most of our patients with migraine or chronic migraine, we really don't need to image. The American Headache Society has recommended that we use imaging when you're really outside those parameters that we typically see day to day with our headache patients. So what I'd like to do is just give you an acronym for when you should use imaging. And the acronym is SNOOPS. S in SNOOPS stands for systemic illness. So if you're seeing an individual who has systemic signs of disease, perhaps they're febrile, maybe they're encephalopathic, maybe there's somebody who has a comorbid condition such as a cancer that might make you think that there's something that's a little bit abnormal in the brain, that would be an indication for imaging. N in SNOOPS stands for neurologic change, and a lot of our patients have neurologic symptoms with migraine. You'll know that many patients have aura. Aura itself, though, tends to last for anywhere between, say, 15 minutes up to an hour. So if you see an individual who has a neurologic change, either has a motor abnormality, perhaps a visual symptom, maybe a cognitive symptom that's going on for more than an hour or so, then that would be a reason to seek further imaging. O is for onset. So with most of our headache patients, they have long histories of headache. So in individuals who have a sudden onset of pain, or perhaps this is the first or the worst headache that they've had in their lifetime, that would be a reason to do further studies. The second O really stands for age of onset. So if you're over 50, that's another reason why you may want to consider doing some further studies besides what you're just doing in your office during your neurologic exam. We know that individuals over 50 are at risk for cranial arteritis, so that would be a diagnosis we certainly wouldn't want to miss. P stands for pattern. So with many of the individuals that we see, they'll follow the same pattern in frequency, intensity, and duration over a lifetime. If you're seeing somebody who has episodic migraine, or perhaps you're seeing somebody who's a menstrual migraineur who only has headache around the menses, and suddenly they present to you with chronic daily pain, that really indicates a change in pattern. So again, it may be a reason to delve a little deeper. S, the second S is for sudden. So if you're seeing someone who has a sudden headache that's very severe, that doesn't go away, you'd want to consider that there's some other intracranial pathology that may be causing that. And so you may want to seek imaging at that time.